Well, my father's fall was a very intense experience. You know, the most frustrating part was it could have been prevented had we taken the appropriate measures. It started 4 weeks ago. It was just another typical night at the Garcia household until...
This Chihuahua. Grandkids.
Oscar. Oscar.
Ay.
Oscar, what happened? What were you doing? Let me try and help you. Come on. Let me try and help you. Come on.
I can't. Just forget it.
Come on. Let me help you. Come on.
Just call 911.
Oh. Okay. Let me call him. Let me call him. Let me call him.
Ay.
911, what's your emergency?
Hello?
911, what's your emergency?
Yes, my husband fell. He's on the floor. I need help.
Sir.
Oh, yes.
Sir.
Oh.
How you doing?
Oh, I don't know. I think I'm okay.
You fell down? Look at me.
Yeah.
You fell down?
Yeah.
Okay. You all right? How you feeling?
I'm okay.
What's your name?
Oscar.
Okay. Oscar? We'll
yeah.
be okay.
Uh,
Did you fall and hit your head?
no, I don't think so.
Okay. All right. Why don't you just relax?
Oh.
BP is 110/80, heart rate 90, respiration 20.
His glucose level is at 80.
Is he okay? He's stable for now. It's a good thing he didn't hit his head.
No, I just slipped and fell. That's all.
We need to take him to the ER for an evaluation.
No. I'm okay. I'll just go see my doctor.
We will. He has an appointment coming up next week.
Okay, but make sure you take him.
I'll get up. Yeah, right.
It was such a struggle to get him to go, but we were able to keep the appointment.
Yeah, but it was just a waste of time.
No, it wasn't, Oscar.
Yes, it was. Doctor wants me to do exercise. Exercise at my age? Then she said there's something wrong with my balance. There's nothing wrong with me. I just fell. And then she mentions this Chinese thing for balance. Tai Chi or Chi or something. And no way. That's some other kind of people.
They weren't exercises.
Okay, so what brings you in today, Mr. Garcia?
No. Oscar, you need to tell her. Tell her.
Well, I kind of fell last week.
Oscar, you did fall.
Okay, tell me about your fall.
Well, it's her fault, but I mean, I got up, like always, go to the bathroom in the middle of the night. And I was okay. I went to the bathroom and just hollering.
Mr. Garcia's case is actually really common. The fact that he has fallen in the past and fallen recently. In fact, the single most predictive prognostic factor that a person is going to fall is that they've already fallen. So when you're screening for elderly patients who will probably fall, you need to ask if they have fallen in the past, especially since the last visit, if you see them regularly. And if they're a new patient, you can ask if they've fallen in the last year. In regard to the fall, you want to know whether there was loss of consciousness, did the person have lightheadedness or palpitations, whether the person tripped or stumbled over something, if they were able to get up within 5 minutes, and if they required assistance to get up. You also want to ask about other potential contributing factors, like drinking alcohol or conditions that may impair gait, like Parkinson's disease. Okay, so can I take a look at the medication that he's taking?
Yes, here you go.
He still wants thorns.
Of course, that's what you're taking. And I know they look messy, but my daughter wrote on the bottles to let us know what she needs to take each time. She even got him a pill box.
Yeah, but I know exactly what I'm supposed to take. I take the little blue pill I take for urine, for my urine, and the purple pill I take for my stomach.
Okay. Well, your physician is going to want to look at what you're taking anyway, just to make sure that there's no side effects that put you at risk for falling.
And what? I'm supposed to stop taking them? I mean, don't I need them?
She won't take you off of any of them. It's just good to be aware so that there's no mistakes. You should also note if the person uses any assistive devices, such as a cane, walkers, or wheelchairs. It's important to check for vision problems that may be contributing to falling. To check the visual acuity with a Snellen chart and examine the eyes for cataracts or other physical problems that may be interfering with vision. You want to see if orthostatic hypotension, which is blood pressure lowering when standing, is a contributing factor. You can check for that by taking their blood pressure in a lying down position and then 2 minutes later when they are standing.
Well, you know, as his primary care provider, when I walked into the room, I could tell Mr. Garcia was a little sensitive about the fact that he had fallen. And as with most patients, it can be a little bit embarrassing, but it's a very serious matter nonetheless. Well, in my initial assessment, I discovered that Mr. Garcia had fallen 3 or 4 times in the past year. The falls had happened under similar circumstances, getting out of bed at night, in poor light, bumping into furniture, pets, and other clutter. However, he was usually able to get himself up until this last one.
No big deal, Doc. I'm an old man. I think it'd be weird if I didn't fall every now and then.
Well, have you noticed that this happens any particular time of day? For example, after you take your medications?
It's funny you mentioned that. Every time he takes his orange pill, he gets a little woozy.
The orange pill?
Yes.
Can you show me?
Hey, this one.
Well, this is hydrochlorothiazide, or thiazide. It's a diuretic, or water pill. And this medication, while it is useful to treat blood pressure, can cause your blood pressure to drop too much when you stand up. And that can increase your fall risk. Well, sometimes patients may not be aware, but certain medications can lead to falls. Some cause dehydration, increased sedation, or can lead to hypoglycemia, or low blood sugar. In Mr. Garcia's case, medications like hydrochlorothiazide, glipizide, lorazepam, and spironolactone, and terazosin could all have been contributing to his falls. Well, for Mr. Garcia, we performed the time to get up and go test, which is an important office-based measure of mobility. It's a quick, easy test you can perform in the office to assess a person's ability to stand, walk, turn, stop, come back and sit down. And usually individuals should be able to do that in 7 to 10 seconds. So if a patient can complete that test in 10 seconds or less, we consider them to have high mobility. Folks who take a bit longer, 10 to 20 seconds, are considered at risk. And folks that take upwards of 20, 30 seconds to complete the test, that's considered somebody who's almost a non-functional ambulator. Mr. Garcia, I'd like to do a quick test to check your mobility and your balance.
Okay.
When I say go, I'd like you to stand up without using the armrests if you can.
Oh, I don't know if I got the strength for that, but
Well, if you need to,
Okay.
go ahead and use the armrests. I'd like you to
Okay.
stand up, walk 10 feet or to the black tape, turn around, come back, and sit down.
okay.
We'll start whenever you're ready.
Okay. I'm up. Okay.
Okay, 28 seconds.
Okay. Was that a good
Well,
time?
that suggests there might
Record-breaking?
that suggests there might be a mobility issue here.
Oh, okay. Well,
Yeah. Well, after the initial assessment with Mr. Garcia, often we're able to make several recommendations. I often show patients how to appropriately use a cane or walker or other assistive devices. I also discuss the importance of neck alert bracelets. This is a bracelet that can be worn around the neck, and if a patient falls and is unable to get up, they can call for assistance. As in the case of Mr. Garcia, I also often refer patients to physical therapy so that they can learn gait and balance exercises, and I might refer them to an occupational therapist who can perform a home safety evaluation. Well, Mr. Garcia, I'm so glad you came in today so we could talk about your falls and ways that we can reduce the chance you'll have another fall in the future. I have several recommendations I'd like to make. First, I'd like to refer you to a physical therapist who can work with you on your gait and do some balance and strength training. I'd also like to provide you with a safety checklist so that you can look around the home and identify any hazards or things that might be increasing your fall risk at home. I think we also need to talk a little bit about your footwear. It's better if you can wear footwear that's going to support the whole foot. Those flip-flops you've got on today are increasing your fall risk. I'd also like you to think about looking in the community to see if there are any Tai Chi classes that you might enroll in to improve your balance and your strength. Okay? I'm also going to recommend that you see the eye doctor to update your eye exam and evaluate your cataracts. Okay?
okay.
And I'd like you to start taking calcium and vitamin D supplements to strengthen your bones, right? And as I mentioned, we're probably going to need to stop your hydrochlorothiazide, the water pill you've been taking. It's very useful to treat blood pressure, but sometimes it can cause your blood pressure to drop too much when you stand up. This can increase your fall risk.
Here, I thought it was all them rugs you put all over the place. I
me.
trip on them.